The fact that you have started viewing this video is the first correct step you have taken to make yourself aware of this unkind disease, which can be managed well if diagnosed early. We here are talking about hepatitis. Hepatitis is a disease that includes any type of inflammation or swelling of the liver. There are 5 main hepatitis viruses referred to as types A, B, C, D and E. All of them can be found in India. Hepatitis A is a short-term infection and gets clear by its own, and no special treatment is required. However, doctors may prescribe some drugs to manage symptoms. Hepatitis E is also a short-term infection and requires no special treatment. As it is spread by the fecal-oral route, prevention is the best approach to the disease. On the other hand, hepatitis B may become a long-term infection, and in some cases, treatment might be needed for the entire lifetime. For both hepatitis A and hepatitis B, vaccines are available. Hepatitis D virus infects those who are already infected with hepatitis B. It can be prevented by taking the hepatitis B vaccine. But hepatitis C shows no symptoms and there is no vaccine available for it. While some cases of hepatitis C virus infection are acute, that is, short-term, up to 85% of people infected with HCV develop long-lasting, that is, chronic hepatitis C. 13 to 15 crore people globally have chronic hepatitis C infection. About 1.5 crore people are estimated to be infected with hepatitis C in India. Hepatitis C, HCV, which predominantly transmits through the parenteral route, that is, via injections, pose a serious silent epidemic challenge to India, as most of the people do not know they are infected. There are various genotypes of hepatitis C virus ranging from 1 to 6, out of which genotype 1 and 3 were found to be the predominant in India. But hepatitis C can be cured successfully if detected early, as we now have higher cure rates, shorter treatment duration, and all oral treatment regimens for most people living with HCV infection. Let's go through a small story and understand more about hepatitis C.
Hey Sagar, today you are back from work very early.
Yes, Sheetal. You remember last week the doctor told me to do few tests for hepatitis C? Hence I went to the lab today to get my reports.
Yes, I remember. Are the reports normal?
No. It shows that I'm suffering from hepatitis C.
Hepatitis C? What's that?
Even I don't know what hepatitis C is. But I am very worried now.
Sagar, I feel we should visit the doctor and understand about hepatitis C.
Yes. Sheetal, I feel what you are saying makes sense. The doctor will be the best person to guide me. Hello, doctor.
Hi Sagar, what happened? Why are you looking so tensed?
Doctor, I just collected my hepatitis C test reports and they are positive. I have hepatitis C and I'm very worried now.
Yes, doctor. We are very worried and hence we came here to understand what hepatitis C is and how it can be cured.
Okay, show me the reports. Sagar and Sheetal, there is no need to worry. I will tell you everything about hepatitis C and how it can be cured. Hepatitis C is a liver disease, and hence, to understand about the disease, let me first explain the function of liver in our body. Your liver is one of the largest and most important organs in your body. Non-stop, 24 hours a day, your liver does many tasks to keep your body running smoothly. It's like a vacuum cleaner. It cleans out toxins from your blood. It's like a warehouse. It stores vitamins and minerals and makes sure your body gets the right amounts. It's like a bodybuilder. It fuels your body the right amount of amino acids and glucose. It's like a factory. It produces an important digestive liquid called bile. It also regulates hormones in your body. Now that we know the role of liver, let's understand hepatitis C. Hepatitis C is a disease caused by the hepatitis C virus, HCV, which affects the liver and causes inflammation of the liver. Once the liver gets affected, it can't do all its jobs properly.
Oh, okay. So, doctor, how did I get hepatitis C?
The hepatitis C virus spreads through the blood or body fluids of an infected person. You could get infected via blood transfusion, sharing drugs, needles, and personal items like razors, toothbrush, etc. Tattoo and piercing via infected needles. Rarely it could happen by having sex, especially if you have an STD, an HIV infection, or have several partners, or by an infected mother who could pass it to her child during birth.
So doctor, are there any symptoms that show that we are suffering from hepatitis C?
Many people with hepatitis C have no symptoms, but you could notice stomach pain, loss of appetite, nausea, fatigue, muscle and joint pain, fever, dark urine, and jaundice.
Doctor, then when can we know that we have hepatitis C?
Since hepatitis C is generally asymptomatic, it's very difficult to diagnose it. A blood test will show if you have hepatitis C. Your doctor may suggest getting a liver biopsy if severe hepatitis C is suspected.
Doctor, now that I am diagnosed with hepatitis C, is there any complication associated with it?
Yes, Sagar. There are various complications associated with hepatitis C. Anything that damages the liver over many years can lead the liver to form scar tissue. Fibrosis is the first stage of liver scarring. But when scar tissue starts building up, it takes over most of the liver, and this is a more serious problem called cirrhosis. If hepatitis C is not managed properly, then it can even lead to liver failure, liver cancer, and sometimes even death. Hence, it is important to diagnose HCV correctly and early, and that is the reason, if you remember, I advised you to do the tests.
Doctor, everything about HCV sounds so threatening. I'm worried about Sagar's health. Doctor, is there any way to treat hepatitis C?
Sheetal, relax. There is nothing to worry. Hepatitis C does not always require treatment, as the immune response in some people will clear the infection. But when treatment is necessary, the goal of hepatitis C treatment is cure, that is, to prevent liver disease, cirrhosis, and liver failure, to relieve the symptoms, and to decrease the risk of liver cancer. Earlier treatment regimens consisted of combination of injection and oral drug therapy. But nowadays, treatment of hepatitis C has become easier due to the availability of all oral therapies. The advantage of these new oral regimens versus the combination regimen is that they carry the promise of easier dosing, shorter duration of therapy, that is 3 to 6 months, better tolerability, increased patient compliance, and improved efficacy. Along with the medications, it is important for hepatitis C patients to take particular care of themselves. This includes regular follow-up with doctor, following proper diagnostic schedules, getting vaccinated against hepatitis B infection, maintaining a healthy diet, avoiding alcohol, avoiding any unnecessary medications, maintaining a good level of physical fitness, and having a good social support system.
Thank you, doctor, for all the information. I'll surely start my treatment and follow your advice.
Good decision, Sagar. With proper treatment and management, hepatitis C can be cured. Hepatitis C can be cured successfully if detected early, and hence it is important to get tested if you feel you are at risk. Speak to your doctor for more details.